I would like to tell you about PAP therapy. PAP therapy is used to treat sleep apnea. Obstructive sleep apnea, or OSA, is the most common form of sleep apnea. When a person has OSA, their throat collapses multiple times in an hour. When this happens, it blocks air and oxygen from getting into the lungs and into the body, which can lower the oxygen level in the blood. OSA is treated with PAP therapy. PAP stands for positive airway pressure. PAP therapy uses pressurized air to hold open the throat so it can't narrow or collapse on itself. It basically provides an air splint to hold open the throat while a person is sleeping. PAP therapy includes a machine which pressurizes the air, commonly called a blower, a tube that delivers that pressurized air to the person, which is a hose, and then some sort of seal that maintains that air pressure using a mask over the nose or the nose and mouth. PAP therapy can have many names that you may have heard. CPAP is one pressure. Auto PAP is an adjusting pressure. Bilevel PAP has an inhalation and an exhalation pressure. And there are some other PAP machines as well. Your doctor, nurse practitioner, or physician assistant will prescribe the type of PAP therapy and pressure that you need. When you're getting adjusted to PAP therapy, it's helpful to know there are things that can make it easier. The machines have comfort features including the humidifier, which helps with dryness when you're using extra air to keep the airway open, and ramp, which helps as you adjust and get used to the pressure. Masks are small, fitting under the nose or over just the nose. And there's also high-tech plastics that make it more comfortable and seal better for your comfort. There's also other equipment available when needed. When you're getting started, we recommend that you start with a smaller mask. This would be a mask under the nose called nasal pillows, or over the nose, which kind of cups over the nose and seals against the face itself. The advantages of smaller masks is they allow you more options for moving around in bed. They tend to leak less from the mask, and you can wear glasses. Sometimes people are concerned about starting with a smaller mask if they know they are a mouth breather. Patients with OSA are often mouth breathers until the sleep apnea is treated. Once we're treating the sleep apnea, that improves, and then a person can use a smaller mask. Not everyone needs a larger mask that covers the nose and mouth to control mouth breathing. Our first steps to control mouth breathing when using a smaller mask over the nose or under the nose would include increasing the humidity level and adding a chin strap. It's important to learn how to use your humidifier, as adjusting this can help you when you're new to PAP therapy. You would want to raise your humidifier level if you are mouth breathing, having dry nose or mouth, removing your mask during the night and don't know why, or you're having nose problems such as running, congestion, or sneezing that you think is caused by the machine. We give you videos that help show you how to change your humidifier, and if you need help after reviewing the video, you can also call your equipment company. Ramp allows you to make adjustments to the starting pressure. If your starting pressure feels too high, you would want to make your ramp time longer. If your starting pressure feels too low, you would want to make the time shorter. If after making those adjustments you're still having problems, you would want to call your doctor's office to talk about other options. You can watch our video that shows you how to adjust ramp, and if you have questions after reviewing the video, you can also call your equipment company. We recommend that you give a mask a few weeks to see how it's going to work for you. Each mask takes a little time to adjust to it. After 1 to 2 weeks, if you're having leaking, where the mask seals against the skin, despite making it tighter and doing the adjustments that you could do on your own, then you should call your medical equipment company to talk about this. Also, if it's causing discomfort, you would want to call and discuss this as well. Often, medical equipment companies will allow you to exchange a mask within your first 30 days. You should call them before you reach 30 days on a mask that's not working for you. We recommend you schedule a time to go into the office for the medical equipment company to look at other options if you need to switch your mask. And whenever you go in for that office visit, please bring your machine with you so that you can use it when trying on other masks. If this isn't helping, you may also need to practice. For some people, their brains have not adjusted to what it feels like to breathe on PAP, and they need to practice during the day to get more used to it, particularly if the starting pressure feels too intense and hard to get used to. That daytime practice helps to train the brain to know how to use PAP therapy and how to fall asleep and breathe on PAP therapy. We recommend 10 to 20-minute sessions a few times a day when you're practicing. This helps you be more ready to use it at night. As you become more adjusted, if you're using ramp when you're starting, go ahead and turn that ramp off for your continued practice. If you're still having problems with the pressure after a week of practice, call your medical equipment company and talk to them. And you may also need to call your office for your doctor, nurse practitioner, or physician assistant who ordered the treatment for you. There are ways to watch your progress. Your machine has screens that will tell you what's going on with your machine and give you information. You can also download an app for your smartphone. If you need help in downloading the app, you can call your medical equipment company who gave you the machine. If you have a Dream Station machine, which is white, you would use the Dream Mapper app. If you have an AirSense machine, which is black, you would use the My Air app. When you're getting started on PAP, the most important things to remember are to raise your humidity. We provide a video for that. If needed, lower the starting pressure with ramp, and we have a video for that. Start with a smaller mask, going under or over the nose but not covering the mouth, and if needed, add a chin strap. And track your progress using the smartphone apps, which also provide you additional videos to help you as you're getting started. It can take some time to adjust to PAP. Allow yourself a few months to get used to it. Initially, people notice that their snoring is better, they're waking up less, they may wake up less to urinate, and they may notice that during the day they feel less sleepy and have more energy. To get the most benefit from PAP, you should wear your machine with all sleep. This would include naps, and make sure you're getting enough sleep. For most people, this means 7 to 8 hours per night on PAP. To care for your machine, remember you should use only distilled water. You should dump your water after each use and open your water container so it can dry between each use. Once a week, you will wash your equipment with soap and water per the instructions of your medical equipment company. This can be plain dish soap or baby shampoo. You would clean the mask, the hose, and the water container. If you have a hose that has an electric plug, please don't submerge that for a long time in the water. There are other resources to help you. These are the addresses to get to our videos and handouts. You can also go to sleepeducation.org for information provided by the American Academy of Sleep Medicine and sleepapnea.org to find information provided by the American Sleep Apnea Association.